I am going to try and tell you how I and others on the autism spectrum may experience going to the job centre. Everyone on the autism spectrum is different, so we will all have different experiences. First of all, receiving a letter or phone call that tells you to attend the job centre can cause massive amounts of anxiety. This is because of the unknown. What is going to happen? Who will I talk to? Where will I have to go? How many people will be there? What will I have to do? Will I have to use a lift? Is it going to be noisy? A lot of questions. The majority of them I ask myself every time I need to do anything or go anywhere. This is why to go anywhere I have to do a lot of planning, even if it is somewhere I have been before. Some of the planning is used to answer a few of these questions so that I can take away a small amount of the anxiety and provide myself with some kind of certainty about what is going to happen. I take a lot of time planning my journeys and I use a lot of different applications and methods. This is because they tell me different things about the journey and the destination. I use travel apps such as Citymapper and TfL's Go to let me know about transport connections, as well as Google Maps and the internet to see the outside of buildings and get information about busy periods. If it is somewhere that I haven't been to before, I will have to do several test runs. Some of these will be just to check out what the building looks like, as well as the usual how to get there stuff. This is so that I can get to know what the normal state of the environment is, especially the important sensory stimuli. If something does change or if the sensory environment becomes too overwhelming, I can have an autistic meltdown. This is where I pass out because of too much informational stress and my body decides to turn itself off and then on again to reset. Sensory issues are everywhere, especially when I am on the journey. The movement of the vehicles, lights, sounds, visual noise and smells. Why do people like eating on buses? And yes, that massive advertisement screen is telling me that if I buy this app I will be more peaceful, but right now I'm fighting the urge to just go home. So many barriers to get over. It takes a couple of days to recover from journeys, especially stressful ones, so I usually only leave home when I really need to. What do I use to help me travel across London? Well, I wear a peaked cap to cut out lighter movement and I wear noise-cancelling headphones to cut out sound. I use travel assistant cards so I can communicate with staff. The transport staff are very supportive and I couldn't travel without them. This is because I need staff assistance every time I use public transport. I'm unable to use stations without them, even stations that I know, and if I get off a train and the staff haven't turned up, I am unable to leave that station without that help. I waited on the DLR platform for 2.5 hours because staff didn't turn up. This damaged my trust in using the DLR. I can't use the majority of the transport network because of my autism. When I get to the building, the anxiety doesn't go away. The questions are still coming as well as the sensory input. Where is the entrance? How far into the building will I have to go? How high up? Who do I talk to? What happens if I get it wrong? What if I get lost? What is that high-pitched buzzing? The first priority is to find the correct way into the building. This isn't as simple as it sounds. There might be people going in and out of different doors, as well as staff and clients might have different rules in and out of some of the buildings. There could be a different rules being put into force because of COVID. All of these can cause confusion or distraction. Finding staff can be easy if there are security personnel walking about. Their job is to let you into the building and point you into the direction of staff. Finding who to talk to can still be confusing. Everyone seems friendly and quick to help, which means that I don't have to worry too much about how to approach someone. With autism, going up to someone to ask for help is scary. When I see people talking to each other, it makes me very nervous. If staff are talking to each other, it's nearly impossible to know whether you can approach them or when to interrupt their conversation. More questions. When do I break into the conversation? Will they be angry? Is this even the right person to talk to? Do they work here? Inside the building, there are a lot of sensory issues. People on the spectrum can be hyper or hyposensitive to certain sensory inputs. Too much or not enough sensory stimuli can cause a change in behaviour or even a meltdown. There are the noises and smells of the building and other people who are inside, the sound of staff typing or on their phones, other people's conversations, the buzzing of lights and humming of machineries, such as servers or photocopiers. The lights might be fluorescent, they might be flickering or too bright, there might be patterns on the walls, visual noise, or too much extra information, such as a large amount of posters or directional signs. The lighting may vary in different areas of the building. One area might be very well lit, while another part might be quite dark. All of this makes trying to communicate with the members of staff very difficult. My brain is trying to focus on one thing while I am being bombarded with sensory input. Having a quiet area or room where you can possibly control the lighting and cut out some of the sound, where someone with autism can wait or even be seen in, can help a lot. Otherwise, use somewhere quieter, in a quieter area of the building, away from busy pathways or doors that are being constantly used. Always use the person's name at the beginning of a sentence so that they know you are talking to them. I call this technique noun-verb because English is verb-noun. Example, pass me the folder, Jim, means that Jim only knows you're addressing him once you've finished speaking. It is so much clearer to say, Jim, that folder, pass it to me, please. Make sure the person you are addressing is paying attention before you ask a question or give an instruction. The signs that someone is paying attention will be different for different people, but eye contact will almost never be present. Be aware of the environment, noisy or crowded, that you are in, as well as sensory differences, which may be affecting how much someone can process. When speaking to a client, avoid using sarcasm, figurative language, rhetorical questions, idioms or exaggeration, as autistic people often take these literally. Sayings such as, it's raining cats and dogs, can cause confusion. When I was younger, I would look for the cats and dogs. It's very disappointing when it is normal rain. Can you take a seat is another one. Yes, I can take it, but it looks quite heavy, and where should I take it to? If you have to leave to do something such as photocopying, don't say, I will be back in a minute, or just give me 5 minutes and I will be back. This could make the person watch the time and panic when you're not back. Say, wait here, I will be back after I have photocopied this. Be clear what you mean and double check that the person has heard and understood. Avoid compound or open-ended questions called closed questioning, e.g., have you had a nice day, will cause anxiety, would you like a drink or to hang your coat up, or would you be more comfortable over here? This is a confusing multi-choice exam in miniature. Break down instructions into smaller, easier to understand bits and have written instructions to hand. Pause between words and phrases to give the person time to process what you have said and to give them a chance to think of a response. Use less non-verbal communication, for example, eye contact, facial expressions, gestures and body language. Use visual supports like symbols, timetables and social stories if appropriate. Non-verbal adults will either write, type, use sign language, picture cards or digital communication devices. When this happens, it is helpful for people to take time to see what they have written or read what they have shown them and then reply as they normally would. Do not stop talking yourself. This makes communication very confusing. Make sure that there is clear signage throughout the building that isn't confusing. Clear signage helps create clear boundaries and gives a sense of predictability and consistency. Just as spoken language is taken literally, so is written language. Every sign has the same importance. For example, on the Underground, the sign you must show tickets on demand is the same as dogs must be carried. Who do I show tickets to and where do I get a dog? My favourite sign at Bank Station proudly states that if you urinate in the area around the sign, you will be prosecuted. This means you can urinate anywhere else in Bank Station. I know there are a lot of things to think about. My main piece of advice is to take people at face value. If someone says they can't go into a room because of the lights, then try and find another room or turn the light down or off. I saw positive things such as friendly and helpful staff, positive messages on disability, and the willingness to learn and understand. Reasonable adjustments for a person on the spectrum are often very easy to introduce. There may be no cost, but these small changes can make a huge difference. There may also be a benefit to others, for example, good communication, clearly defined procedures and structures, and willingness to be flexible are positives for everyone. Please don't worry about having to get everything right. It will take time, and the person on the spectrum will notice that you have made an effort and will appreciate it.